Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Thank you for joining us today. So the pandemic continues. The good thing is the mortality rate has decreased a little bit, and we think that's for a couple of reasons. Those people getting infections now are younger, and we don't see as many deaths in younger patients with COVID-19 as in the older group of patients that we saw. Better treatments may be another reason why we're not seeing as many deaths as we were. They are used early in the disease to be effective, and these treatments include convalescent plasma. These are antibodies from symptomatic COVID-19 patients who have recovered that give their plasma. Their antibodies are then used in patients who have active COVID-19 infections. It appears that this doesn't reduce the mortality, but it does seem to help patients get better and reduce the amount of virus in the body. Another one is monoclonal antibodies. These must be used early as well, and we're talking about 7 to 10 days maximum from the onset of infection. These antibodies are grown in the lab in tissue cultures. The antibodies are given outpatient through an IV over an hour, and it's done to prevent hospitalization in patients who don't really require hospitalization yet, but may get to that point. It's important then to be evaluated if you're COVID-19 positive with cough, shortness of breath, chest pain in the first 7 to 10 days. If you have symptoms that seem to be getting worse and you have questions, be sure to talk with your doctor, because after 10 days, most of these cannot be used. Remdesivir is another treatment that we've been using now for a while. This is an antiviral drug, and it also enhances recovery and shortens hospital time, but has not really been associated with decreasing the number of deaths that we see. Hopefully, better antivirals are on the way. Now, there's 3 SARS-CoV-2 strains or variants or mutants. You may hear any of those terms, and they are more contagious than the strain that we already have been seeing here in the United States. The first one came from the UK. It is now in several states, and primarily Florida, California, and New York have the highest numbers of these patients. These variants are known to be more contagious, but it doesn't appear that they cause more deaths than the strain that we're already seeing. The one from South Africa and the one from Brazil may or may not be covered by the vaccine. They have more mutations than the one from the UK. It's believed that the one from the UK actually may be covered by the vaccines that we already have. Now, remember, the vaccines that we have are the Pfizer and the Moderna so far. Messenger RNA vaccines is what these are called, and they send a message to our cells to make a protein similar to the spike protein on the SARS-CoV-2 virus particle. Our bodies develop an immune response to that protein, and we then make antibodies as part of that immune response. If and when we see the protein again, such as when we are exposed to SARS-CoV-2, the antibodies begin to fight it. Time is not wasted making the antibodies while the virus reproduces in us, because we already have the antibodies. That's the advantage of the vaccine. Now, we will need to continue our safe practices, which include hand washing, mask, distance, and avoiding crowds for several months yet, even after taking the vaccine. This will have to be until herd immunity stops the virus, like what we've seen with polio and other diseases. Scientists are not certain yet if the vaccine will prevent symptomatic spread. The intent of the vaccine is this: for individuals to make antibodies without the risk of severe infection or death, so that we can acquire herd immunity without having to get an infection. Secondly, to prevent a severe form of COVID-19 requiring hospitalization, possibly intensive care or ventilator. And thirdly, to stop the spread of the virus, to stop this pandemic, and to stop the deaths. Now, the vaccine is in a shortage right now. We're waiting for more, but we're still vaccinating patients age 75 and up. To make an appointment, if you would like the vaccine, you can call, and this is for Nashville, Davidson County, you can call 615-862-7777 or go to covid19.tn.gov/vaccine or asafenashville.org. I hope you had a blessed week and that you're going to have another one this week. As always, stay safe, stay healthy, and stay prayed up.